We're at Lee Davis Neighborhood Community Center, and we've partnered with USF School of Medicine to provide the manpower, the nursing staff, the clinical staff, the administrative staff for this. And between the county and the city, we're providing the command and control and all the supplies needed and logistical support. So far it's working very, very well. The capacity of this site is 300 appointments a day. So that's what we shoot for. Same thing goes for our other community resource sites. And we've actually implemented some efficiencies at Raymond James. So now we can accommodate up to 800 appointments a day. So that's our current clip that we're running at right now.
It's really critical that we do a lot of testing. The reason for that is the test that we're doing today is a swab that detects viral RNA. So it tells you are acutely infected. But the problem is that that test, even when perfectly done, has about a 20% false negative rate. And so what we're trying to do is test everybody, as many people as we can. And there's a very good chance that we will detect most of the patients that are infected. And by being able to detect them and identifying their exposures, detect all the people that are infected. Because what we're trying to do now in Hillsborough is contain the infection, not just mitigate it.
This was done on rather short notice. It's actually an inspiring story because all these entities in normal duties, normal days, non-COVID-19 are somewhat rivals. The emergency bell rang, everyone came together regardless of what team you're on, regardless of what shirt you're wearing, and got shoulder to shoulder and started pushing the boulder uphill. So because we were able to get that all together and come together as one, we were able to make this happen and other sites like Raymond James happen rather quickly.
This is kind of all new for everybody. This is something that we not expect at all. And we're trying to do our best every time, every day. We have a lot of compassion for everybody that show up here. Some of them show up crying, saying they're scared. I hope that we're going through this the fast as we can. And as the doctor says, everybody should be tested at this point.
Thank you for calling Hillsborough County.
Our producers followed Tampa resident and WEDU CEO Paul Grove as he signed up for and took a COVID-19 test at the Plant City site. Here's a closer look at the process.
It begins with folks calling the call center and getting scheduled for an appointment. When folks call, they will be given the option of a location or a date, and then they select that appropriately. They're given a unique appointment code that's sent to them. Once you drive in, you get to what we call Station 1, which is where your appointment and identification is verified, just to make sure everything's lined up, because that has to be 100% correct. If someone's name is misspelled by one letter, they won't be able to access their results. So we just need to make sure that is 100% buttoned up. That's done right there. All that's verified. And then they proceed to what we call Station 2, which is where the actual test is administered.
Say take a deep breath for me. Stick your tongue out. Awesome. Great. All done. You did awesome.
Once the test is administered, they're given their handouts showing what to expect, how to access their results, and then they go.
Well, that was not as bad as I thought, and I was really expecting much worse. It was a little tickle to the back of the throat, but they did a wonderful job, and I would encourage everybody to do this.
We are the safest spot on the earth to be. We are absolutely, taking no chances with our own health or anybody else's health. I wear, obviously, an N95 mask, and I have a hood. I have 2 layers of gloves on. That's a lot of stuff. They're not going to catch COVID-19 from us, and hopefully we're not going to catch it from them. So, it's a very safe place to come and be tested.
It's a simple process, 100% free. There's no need for a doctor referral. You don't even have to have a primary physician. Just call, make your appointment, get tested, and you're clear. So that would be my recommendation, is to just go ahead and do it.
Thank you, everybody. Thank you.